welcome to Dr. Vivien Brown, family physician. First time on City Line. It's so good to have you. You know, we want to talk about a very important topic in a lot of women's life right now, and it is the loss of libido after having children. So, you know, there's the dating phase where things are great, and then there's the, hey, let's get serious, where things are still great, and then there's, oh, we had kids, things stop. Or maybe they're just very slow. And there's a lot of reasons why. Why would you say that happens?
Life changes for all of us when we have children, and I think that's pretty normal.
Yeah.
But really, research shows that about 7 out of 10 couples feel they've lost spontaneity in their relationship and in their times for intimacy. And I think one of the things that we're looking at is really how to get back a little bit to where you were. Because if you're intimate as a couple, if you're strong together, you're going to parent better together, and it's part of a continuum in life.
Right. Okay, so we all know that sex is important because, Lord knows, we talk about it all the time on the show. So sex is important, we all know that, but spontaneity, when you say that, I think about my 5-year-old and my 2-year-old just opening the door and coming in.
Exactly.
There's no spontaneity in our love life right now. So how do you bring that back
well,
when there's always this question mark?
Yeah, I think there's sort of 3 R's that you can think of, 3 ways to remember this.
Yeah.
One of them is to reclaim your bedroom. You know,
Right.
Our bedrooms, we have our laptop on our abdomen, we're busy on our cell phones, we're having snacks, we're watching the hockey game, we're doing all kinds of things in the bedroom that really are not couple relationship things.
Right.
So I think reclaiming your bedroom as a sanctuary for yourself and for your partner really makes sense. Another thing is to reschedule. You know, we talk about sex being spontaneous, and it's a bit of a contradiction, but if you don't plan for spontaneity, then it never happens. And so we're...
Interesting. Okay, so you have to plan for the spontaneity.
Well, it's like date night. It's like tonight's going to be our night. Let's get a babysitter, or let's put the kids to bed a little bit early, or let's make ourselves and our relationship the priority. You know, we're not the priority most of the time. It's soccer games and hockey and dance practice and all the things we want to do with the kids, and did we make our lunch, and you know, what I have to do for work tomorrow. But if we don't make our relationship the priority at least some of the time, then that relationship is not going to be strong and healthy. Okay. And I think the final thing is to really rethink what you're doing for contraception. In the study, it really showed that about 1/4 of the women surveyed really were concerned about contraception and forgetting pills, forgetting to use something, and that is stressful.
Yeah.
And if you're already fatigued, if you're already stressed, if you have your kids in the bedroom, if you don't have time to begin with, then it's really low on your list. And that's what this is all about, is maybe rethinking what you're doing so that you and your partner have a stronger relationship.
So when you say rethink your birth control, because that's a very good point, and as a matter of fact, when I was reading your notes, that was the first time I really thought about it. There are a lot of couples that don't want to be pregnant again, and that puts a real damper on being in the mood, right? Because you're thinking, we can't afford a 4th baby or a 3rd baby or what have you. What should you be doing then in terms of birth control?
Well, one of the things that I think is really important is there's a category of contraception that is now being referred to by physicians as LARCs, long-acting reversible contraception. That means you're not making a permanent decision, but you may be rethinking what you're doing so that it doesn't require daily attention. Something that requires daily attention, like the birth control pill, is great contraception, no question about it, but if you're forgetting here and there, and about 50% of couples in a study forgot 1 or more pills in the first 3 months of starting.
Yeah.
So if you're only taking it some of the time, it's not going to work for you as you think it will.
Okay.
So a long-acting reversible method may be something that you want to consider, and you can talk to your physician about that.
Okay, yeah, go see your doctor about what those options might be. The other thing I want to deal with is, what if you have, at what point is a loss of libido something to actually go to a doctor about?
You know, Tracy, that's a really good question, because in medicine, one of the things we think about is if something is a concern to you, then it should be evaluated. So, you know, when we look at older couples, for example, couples in their 70s and 80s, if they have low libido but it's not a concern, then medically that's not a concern. Whereas if it is a concern to you, and particularly with younger couples, of course it's something you should talk to your doctor about, because lots of things can affect libido. Stress can affect libido, hormone changes after pregnancy,
Yeah.
drug interaction if you're on various medications for different things. So there's a lot of things that may be affecting you that you may not be aware of.
Right.
And so my general feeling is if it's a concern to you and your partner, and I do think it should be a concern to you and your partner if it's drastically different than it was before,
Yeah.
then it's something you should talk to your doctor about.
Yeah, because in most cases, one of the people in that relationship will have a problem with it.
Exactly.
And I'm not calling you out, men, but someone's probably going to have an issue with it, and at that point, it becomes an issue for both of you. And
Well, and you know, I'm totally biased as a family physician. We
Yeah.
really think about families holistically as a whole. And so when we're looking at couples, when something is affecting one person, let's say it's not something about sex, let's say it's depression or high blood pressure or diabetes. When something affects one person in the family, it usually has an impact on everybody else.
Yeah.
So I think it's important for you to maintain that relationship and talk to your physician.
okay, Dr. Vivien Brown, great information. Thank you for that. Let's go to break. More coming up. Stay with us.